Hi, everyone, and welcome to our episode of Ask NP Deidre with Nurse Practitioner Deidre Arms out of Ohio with Aspire Wellness Integrated Health, AspireWIH.com. And so excited. It is P.A.D. Awareness Month, poor circulation in the legs, known as peripheral artery disease. Yeah, your arteries are on fire if you have this. So much going on in your body. And the number one question we get asked by people who have PAD is, what supplement should I be taking? So that is something that we are going to talk about today. Remember, the advice and views offered, they're not a replacement for your own healthcare team. Always, always, always ask your own healthcare team for explicit consent before following any information that we do provide here. This information is purely for educational and informational purposes only, and to be used to have a more productive conversation with your own healthcare team. So with that being said, Nurse Practitioner Deidre, oh my gosh, there is so much going on when it comes to PAD. There are misconceptions. There are a lot of companies out there preying upon these patients saying, oh, take this supplement, drink this juice, and it'll clean your arteries. So, is there any truth to what we're hearing?
So I would say anytime there are big claims like that, we do have to be leery. So watch out for that. But if we're looking at evidence supported approach to PAD supplements, there are a few that have been looked at and researched some, but like many supplements, they don't have the randomized control studies that are needed like medications to support a lot of what they have. So what I always say is, I look for studies from the National Institute of Health on different supplements and medications, and you
Yeah.
also have to look at what you're taking to make sure there's no interaction between those. So watch for those big, you know, hey, claims of something to clean an artery or something like that, because um, not actually happening.
No, I haven't heard of an actual artery cleansing system that has been proven effective.
Mhm.
What I have seen are certain supplements that may help in reducing inflammation of the
Yeah.
arteries and helping with blood pressure. And so there are supplements that and also some supplements that do help with A1C, and those are all risk factors for PAD.
Right. So we want to target inflammation on anything that we're any chronic condition. Inflammation is always a driver. So reducing inflammation in the body, even with some simple things, using food as medicine. And there are some great supplements that can help, but it's not a one size fits all either.
Now, can we go through some of the ones that you think are ones that you would believe in that do have some clinical evidence?
Yeah. So, first of all, reducing inflammation would be your omega-3s. I really am a big fan of adding omega-3 in ginger, cayenne, things like that to reduce inf inflammation. Turmeric is a good one. You do have to watch that on blood thinners, though. So, if you're on a blood thinning agent, you have to watch curcumins and things. But those are well studied. They have some good decrease in inflammatory markers. Adding in fiber into your diet can be very helpful too, in just getting high antioxidants and things like that. But fiber is really important. And then there are supplements, if we think about nitric oxide and cardiovascular, so there are some good things that can help improve nitric oxide, and that there's nitric oxide supplements as well. And then nattokinase is a big one. I know that was one that you might see a lot of claims about nattokinase to like clear arteries, but it's actually not been proven to clear arteries. But there, in an effective dose, there are some benefits to reducing inflammation as well. So not cleaning arteries. So
It's just preventing, at least trying to prevent new plaque buildup, because where there's
Mhm,
inflammation, the body is like, "Ooh, wow, we need to patch that stuff up. We need to send in the patching crew, the construction crew, the fire crew to put out
mhm.
that fire."
Yeah, exactly. So you want to just be mindful of those skeptical marketing things that we see on the social medias. Anytime there's a term like clean arteries, it's really oversimplifying what's happening to our patients, right? So, like, because there's not anything that goes in like a roto-rooter and cleans out the artery.
No, we've heard of some nanobots. They're looking at some nanobots going into the arteries and munching on some things, but haven't seen anything grander except some isolated university studies where they're looking at, the nanobots in the very, very early stages. But you're talking about rock hard calcium in many
Mm,
cases in the arteries, and we have no proof that there's anything out there that is truly going to melt this rock hard calcium. I could see, if you're talking about cleaning the arteries, that there might be some, way different way to think about it for people who might be hypercoagulable and have some clot in there, and there might be things like celery, and you were talking about turmeric and some of the other things that may thin out the blood a little bit. That might help. Maybe that's what they're talking about with maybe
mm,
cleansing the arteries, but even then, that could be pretty dangerous if you are hypercoagulable and you're not under the supervision of a doctor and taking this type of medication. It can lead to increased bleeding, especially if it's paired with your own blood thinning cocktail, such as antiplatelets or anticoagulant therapy, right?
right. So you want to be in a collaboration with your provider on this for sure. I don't want you to go out there and just order a supplement off Amazon or
Yep.
somewhere because it has claims of something. So get with a provider that's educated in your disease state and really look into that. Things that are helpful for like blood sugar and stuff like that, it's really sequencing of what you eat can be as impactful in reducing inflammation and lowering the blood glucose spike, making sure that you're getting vegetables first, followed by protein, and then any of your carbohydrates last in your meal. That can reduce a glucose spike by about 30 points.
That's a
So
lot. That's a
adding
lot.
that
That's
in,
significant.
it is. And so I will do just a few of these little tweaks with people's diet to see how they respond. If you have the ability to wear a continuous glucose monitor and you're doing that over several weeks, you're going to start to see what foods are helpful for you to eat first, but always try to get in your fiber first. So those vegetables are really important. And so that can help blood sugar. We know if you have elevated blood sugar, you're going to have inflammation. Like it just goes hand in hand.
Mm. Yeah, and that's gonna be the first risk factor for PAD. That's one of the biggest risk factors, is that high
Mhm.
A1C, and just having that one extra sugar molecule in your blood can damage your artery walls, leaving, those small, dense LDL particles to eke into the vessel wall and push it on out to block blood flow, particularly below the knee and into the feet. And that's where we're seeing most of the patients who have diabetes, and along with PAD. It's that the tough to treat below the knee arteries that are critical. So first and foremost, getting that A1C under control is going to be huge. And we're seeing, I don't know if you've seen some of the studies, the STRIDE trial, which was really big with semaglutides. And it's
Yeah.
not a supplement, it's a regular medication, but they're actually seeing, and they target the inflammation, that they're saying because these drugs actually reduce the inflammation significantly in these patients with diabetes, that they're able to walk further and
Mhm.
faster if they have diabetes and PAD, if they're on this medication. So reducing the inflammation, as you've been talking about, it's a really big deal. And you can do it naturally with anti-inflammatory diet as well as the supplementation that you're talking about, right?
Right. You can do it naturally. One thing we need to think about always comes back to the gut microbiome when we think about things, but
Yep.
you make your own GLP-1 in the gut. So just really eating foods that are butyrate producing, like ghee, resistant starches, things like that, feed the colonocytes. It can help with that. But if your gut is optimal, you're definitely going to have decreased inflammation. And I'm a huge proponent for what semaglutide tirzepatide does when it comes to inflammation, diabetes, and even cholesterol reduction, especially with like Manjaro.
Yeah. What about things like chia seeds or Ceylon cinnamon? I've seen a couple studies, especially on Ceylon cinnamon and how it has an impact on A1C in particular, but also chia seeds I saw are contraindicated if you're on blood pressure medications and if you're on insulin because in large amounts they work so well to reduce your A1C and blood pressure. Have you seen anything on that?
Yeah, so right, when you're using a supplement, you definitely want to do the monitoring because if it's reducing things, your burden of medication is often decreased. So I work with patients to deprescribe a lot of times. And so when we start to add supplements, we don't just want you taking it and not monitoring anything. That is
Yeah.
not optimal. So making sure you're monitoring as well as so that you can start to deprescribe if that is what you and your practitioner's working on.
Yeah, that's really important. What about beetroot powder?
Uh, I'm a big fan of beets and beetroot
I know
powder.
you mentioned
So
the nitric oxide you earlier, and I know that that's a
yeah.
big part of it, but I don't think that people put two and two together when you talk about that. And so it involves beetroot powder.
Yeah, it does. And nitric oxide is really important for cardiovascular and for um, blood pressure as well. So, and you can even test if you have adequate oxide. There's test strips. So I tell patients often, like, you should probably, like, if you want to know if it's helping things, you know, test after before and after you've eaten the food. I have a gentleman who has pretty significant PAD, and he said he eats his watermelon. And I said, I don't know that that's enough. Let's try this out. Let's see. But yeah, beetroot and beetroot powder is good to do that. And so I think anything we can add in food wise and eliminate any highly processed foods is the most impactful things that we can lifestyle other than walking, stomping, walking.
Moving, move, 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 move.
Yeah.
The best exercise is just getting up from your seat. That's a big step in the right direction. What about collagen? Because I had a patient who is now in her 90s, and she is an attorney. She never retired, still goes into her practice, doesn't go to court anymore. She was diagnosed with pretty significant PAD in her iliac arteries in the groin, and she refused to have any sort of procedure. And her daughter was a functional medicine practitioner way back when I'm not even sure you could get a certificate in functional medicine, but she was a big proponent of natural methods to improve your prognosis and put her on heavy doses of collagen. And they claim that that made the difference for her. I'm not making medical claims, I'm only sharing an experience that this patient in particular had. And there could be a lot of reasons why she still is doing well, but collagen, what are your thoughts?
So I do know that the hydrolyzed collagen is a more superior than some of the other ones that we see. Collagen um, basically is a main structural component in your arteries as well. So it helps with healthy vessels, elastin to help maintain that flexibility. I love these patient cases where you actually know somebody who's done something like this because supplements are not studied like meds are studied. And so, like, a lot of times we miss out on the benefits of things because they aren't being studied by the FDA. But to hear a story like that, somebody
Yeah.
who's in their 90s to reverse that, we do know that there's evidence that there's wound healing, joint health, skin elasticity with collagen. There are no randomized control studies really that it would improve PAD, but when you're, hearing the story, you have to wonder, is it just because we haven't studied it to know?
Yeah. And you mentioned ginger right in the beginning. And I love this because ginger is what's considered a vasodilator. And you've talked to this in many of our Ask NPD broadcasts over at youtube.com/, the outside the way to my heart, or ask, is it under, it's at Deidre Arms?
At
Is your
MPD.
Ask NPD is her YouTube as well. You can go check them out there on her site as well. But there is a drug that is part of the PAD management guidelines, both here as well as in other countries. And it's called cilostazol or Platal, and it is considered a vasodilator. That's, of course, prescription strength. But the problem with it is when it only works in 30% of people, but when it works, it really works. But if it doesn't work, the side effects suck. So it's the ginger has been a go-to for a couple of our vascular surgeons who have literally, in a sense, prescribed ginger a couple times a day for some of these PAD patients, and they say it helps them with their walking.
Yeah, ginger, as you know, has lots of benefits. And we've talked about this many times, like you said, and things, but like 2 grams is about where we say start to be a therapeutic. So a lot of times people say, if I cut up some ginger and put it on, or I do a ginger shot, is it enough? And that's the whole thing. It's the therapeutic dose. So like working with vascular cardiovascular who knows the dosing for that patient is really important. So that's kind of awesome that they're using ginger more. Yeah, I think in every specialty we start to see people become a little more comfortable with research supplement or lifestyle thing that can really help in that area. And so overlapping things are things that are decreasing inflammation.
And And I think one of the reasons is, despite all the clinical evidence that's out there for a lot of these different drugs out there, whether it's the cilostazol, the vasodilators, or the statins, or the blood thinners, or whatever, there is a large contingency of patients that end up saying, you know what, doctor, I don't want something artificial. I do want something natural. And I want to see if it works first. And so doctors are now saying, okay, well, we got to figure out a way to do something and get these patients to do something. And if they're willing to be at least somewhat of a partner in their care and, take something natural and at least try it, then, why not start? And so for some of the doctors, they're saying that, you know what, I tell the patient to come back in 3 months, just try it, just try the natural stuff, and we'll redo your blood tests. And if things haven't changed, well, then that's a conversation where we're going to have to then put you on some regular medications. But they're willing, if their life isn't on the line or their limb isn't on the line in the moment, they're willing to at least try. And I like that they at least have a more open discussion about it with their patients and try and meet them where they are and create a plan that makes the patient feel comfortable and hopeful.
Yeah, I agree with that. Having that shared decision making with your patients is really impactful because we can have the very best plans for our patients, but if they're not committed to healing and doing a part of that, because it's a relationship of like, I'm not just going to tell you what to do. Same with another practitioner, and know that you're going to go home and do it. It has to fit your life. It has to be something you're vested in as well.
And so the key takeaways here for those who are listening, the key supplements, your faves, that they should have a discussion with their doctor about, or ask for a referral to a dietitian or nutritionist who can better customize or personalize their supplementation regimen for them. What do you think?
Yeah, I would say look at your omega-3s. There's a lot of study there, essential fatty acids, ginger, the beetroot, anything that helps improve nitric oxide, turmeric, So look into those first. Look into decreasing inflammation before you go into the levels of all these other things that have claims, because starting with decreasing your inflammatory markers is the best place to start.
And we got a question about spirulina. What are your thoughts on spirulina?
I think we've had this question before.
Mhm.
Yeah,
Yes.
so I don't use spirulina much at all. I really work with just decreasing inflammation. I don't think there's anything negative about spirulina, but yeah.
Not one of your favorites.
No, it's
Not one
not
of your
one of my
go-tos.
favorites. Well,
I know one
most
of your other
people
go-tos.
don't like it. They don't like the taste of it. So,
They can take capsules. I've
yeah,
seen the capsules.
yeah,
And I've had a couple friends with cancer that ended up adding spirulina into their diet as well and making it a part of their morning smoothies and a big deal about it. So I don't know all the research on it, but
yeah,
I do know that there are quite a few people. I just don't know if it has an impact or not. It isn't one of my favorites either
yeah.
to
So
take.
not that it's not good or anything, and um, I'm probably more, even for my cancer patients, of vitamin E, like getting the right vitamin E dosing and everything, because I've seen studies on that and reduction of things. So I do like vitamin E because it's a powerful antioxidant.
You know what? We forgot a very critical one that I know is one of your top three. It's vitamin B. And
Oh,
you talk about mechanics all the time, prescription strength
yeah.
vitamin B. And in hearing from you about vitamin B, it's changed my dad's life with the neuropathy. It is gone.
Yeah, that vitamin B and the Metanexus, the prescription part of that, that brand direct is where you would have your practitioner send that to. There's a lot of great studies on that. And you're right. I had a gentleman stop in the other day and he goes, that sample you gave me of that stuff, like that helps so much. And I was like, let's send the script. Let's go for it. But what's great is I get to sample patients and see how they feel on that. And I'm a huge believer in B vitamins. I mean, it helps nerve conduction, and that's a methyl form of B vitamin. So 40 to 50% have that MTHFR genetic mutation. Watch that episode to know a little bit more about that. But this is the special kind of B vitamin for those people. And so it really works.
Yeah. Thanks so much, Nurse Practitioner Deidre. We really appreciate you. We're going to keep on the PAD topics, I think, this month. Maybe next week, we're going to talk about just planning your diet around your PAD. So make sure to join us and don't forget to reach out to Nurse Practitioner Deidre Arms. If you're in Ohio, she also has telemedicine practices in different states, across America. So make sure you check in case it might be right for you and she practices in your state. You can go to aspirewih.com. And don't forget that little notification button. Make sure to hit that on our YouTube channels and subscribe to our YouTube channels for more great content like this. Thanks everyone for joining us.
See ya.